Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the Montgomery County Latino Health Initiative? Find out right now. My guest this evening is Sonia Mora, Senior Manager of the Latino Health Initiative. Ms. Mora, welcome to Housecall.
Thank you so much. It's a pleasure to be here with you.
Thank you so much. In any case, tell our audience briefly about your professional background and how you came to be the manager of this important health initiative.
Well, yes, my background is in actually public health. And I have a bachelor's in science, but my passion has always been public health. And I started working for Montgomery County about 26 years ago. So I've been with the county for a long time, and I've been proud to serve for Montgomery County government for the past 26 years. I did a lot of health education and outreach, and I started my career working in HIV back in the 90s when the epidemic was just starting. And worked a lot with the Latino community, doing outreach, education, and after that I was managing contracts. But about 16 years ago, the department, the county council, and the county executive felt that it was an important fact to begin a Latino health initiative to address the needs of the Latino community. And I was fortunate to be there to start the initiative 16 years ago.
How gratifying.
It's been wonderful. It's been a real journey, and 16 years later, I wish I didn't have to be here, but the needs of the population are there, and we have to continue working to address health issues, health disparities, health inequities in the Latino community.
Now, you mentioned the Latino community. Let's discuss, first of all, the Latino community nationally. And then focus specifically on the community here in Montgomery County. What is the size of the community? What countries are represented, etc.?
So the Latino community has been growing tremendously in the past years, although Latinos have been in this nation for a long time. There are people who say that Latinos never crossed the border crossed them back in the past century when Mexico lost all its northern territories, which are now Texas and all the Southwest. So the bulk of the Latino community here in the United States is actually of Mexican descent and has been here for a long time. For Maryland in Montgomery County, the immigration started later. The biggest flow of Latinos came in the 1980s with the wars in Central America, particularly in El Salvador, and people were fleeing violence and came here to Montgomery County, particularly in Tacoma Park. There was a large segment of the community. So now we are about 165,000 Latinos that live here in Montgomery County.
Out of a population of 1 million.
Over a million, yes. So we are about 19% of the community of Latinos. 35% of the Latino population in Maryland lives here in Montgomery County. So we have the largest Latino community here in Montgomery County. The bulk of the population is, unlike the national level where we have Mexican Americans, the bulk of Latinos here in our area are from Central and South America. And the number one country with Latinos is El Salvador, then we have Peru, and then Mexico. So that's kind of an overall. In terms of where are they living right now, they're really spread throughout the county. With high concentrations, for example, in Wheaton, where close to 40% of the population of Wheaton is Latino, and then we have concentrations in Gaithersburg, Montgomery Village, Silver Spring, the Rockville, Aspen Hill area. And so that's where they're mainly concentrated. Another thing is Latinos are a young population, very young. The median age is about 30 31. If you compare it to the county as a whole, it's 38. And about a third of Latinos are under age of 18, so very, very young. I'm trying to think of other demographics.
Of this population of 160,000 plus, what percentage are first-generation Americans? They've just emigrated here. And what percentage are second-generation Americans?
So about 60% of the Latino community who lives here in Montgomery County was born outside the United States.
Okay.
And about a third of our overall county population was born outside of the United States. But what we're noticing, you know, in these past years, and I told you I've been privileged to work with the community and with the Latino Health Initiative for the past 16 years, is that we're, of course, seeing more and more people that are being born here. In the school system, for example, we have 30% of the school children are Latinos, and most of them were born here in the United States.
Right.
So it makes it interesting to work with them, because then we have individuals who recently arrived who might have barriers with the language, who don't know the system too well. At the same time, we also have individuals who, you know, were born here and who prefer to speak English. And so when we reach out to them, we have to take those nuances into consideration.
What are some of the healthcare challenges that are unique to the Latino community?
I don't know if they would be unique just to Latinos, but maybe to some of the immigrant populations, the recently arrived populations. The whole issue of the language can be complicated. We don't have yet, although we have made tremendous progress here in Montgomery County in terms of providing language assistance to those who don't speak English very well, but we still have barriers with the language, and we don't have sufficient health professionals who actually speak the language and who are not just speaking the language, but who understand the culture. That's a big barrier. Another big barrier is the whole issue of access to care. And the number one situation, number one problem is the fact that many Latinos do not have health insurance. With the Affordable Care Act, many Latinos who qualified actually joined and got health insurance. So uninsurance rates went down and have been going down. Right now, we're not sure how that's going to turn out. We do have anecdotal information that some individuals who had originally signed up for the ACA with the current political climate are not signing up again because they feel that they're probably ACA is going to be repealed, and what is the use then to come and sign up for a program and not be there in the future. Other barriers are the fact that because many Latinos work 2-3 jobs, and you're trying to access services, sometimes services are not available during non-business hours, if you will. So what happens many times is that individuals who are working low-wage jobs will not seek medical care, because what that means is that if they go to see the doctor, then they're going to lose wages.
Right.
And so not having flexible hours of operation can also be a big problem. Maybe not having geographically located services where Latinos may be can be a challenge. Montgomery County, we all know that transportation is a big issue. The traffic has become very interesting, to say the least. So the issues of transportation can also be barriers to seeking care. And frankly, more in the recent past, not because of our county government, because you know that we're very open to immigrants. And our leaders, our executive, our council are extremely open. We're a welcoming community to immigrants.
Yes.
But unfortunately, the anti-immigrant sentiment nationwide actually poses a problem. It poses a problem because people are afraid to seek services because they think they may be deported. Not everybody makes the distinction between federal and local government.
Right.
So that's one of the reasons why people will not seek care. And the other thing that we're seeing significantly right now, particularly with children, is anxiety and depression, because they feel that maybe their families are going to be broken up and parents may be deported. So all these situations have a direct impact on people's health and their health status and well-being.
Well, certainly our viewers should be aware that with the angry dialogue of President Trump and the Republican Party, these are some of the grassroots consequences of what happens.
They're serious consequences, and I think they have an impact on everyone, not just the Latino community. If people, for example, are not seeking care because they're afraid, it might have consequences, even with a simple cold. If people don't seek the treatment, and then they wait until they're very sick, of course they go to the hospital, and then the costs increase.
Sure.
And that has an impact on all of us. It has an impact on people maybe being afraid to report crimes because they might be deported, and then that affects the whole community. So I think it's important for the overall community, what we call the receiving community, to understand that the pockets of these particular populations, whether immigrants or other minorities, if they're not in optimum health, if their wellness is not taken care of, it does affect all of us in the community.
Do you find that immigrants from some of the Latin American countries, for example, Mexico or Cuba or something, or other countries where health care is just provided by the state, when they come to the United States, it's overwhelming when they realize that it's not automatically state provided, but instead it's different types of private insurance?
Yes, it's really interesting. There is a concept called the Hispanic paradigm. And this talks about how immigrants who come from other countries in Latin America, regardless of their income, immigration status, have better health status than people living here in the United States, white people who've been here. And why is that the case? Then people talk about how behaviors in our Latino countries may be better than in this country, because as people stay here and are culturized, the longer they stay, the worse their health status gets. They start eating fatty foods, they don't walk as much. I mean, there's a whole set of behaviors that we have here in developed countries that are not very conducive to optimum health. So, but the one part that it is difficult for them is the fact that they don't have the access that they probably had in other Latin American countries. Certainly Cuba has universal access, and they cover in other countries in Latin America. It is easier for somebody to seek care, and the state kind of subsidizes some of that healthcare access. So yeah, it is interesting, but you know what? I don't think people come here to get medical care, because they come here and they're here to work.
Economic opportunity.
Absolutely. So they're working 2-3 jobs, and the last thing on their minds many times is seeking health care. Certainly that's the case for adults. Maybe for their children, they do want some access. And luckily we have some programs in Montgomery County that help the children to get medical care. Programs that are sponsored through the county.
Yeah. And the irony is that I've read many stories of Mexican American citizens who are now American citizens, but because they're working multiple jobs and none of them provide health insurance, they actually go back to Mexico to get health care.
Oh, yes.
Because they claim dual citizenship.
Not just Mexican Americans. Excuse me. I can tell you that, for example, with dental care, because the insurance is so poor in this country, many people who can afford to travel back to Latin America, I have no individuals, some originally from Colombia and South America, that people will go back to get dental care because it's so much more affordable. So, and the same occurs sometimes with medications, that people will bring in medications from their countries because medications are extremely expensive in this country, and unless you have certain coverage, it can be prohibited for medical treatment.
Now, what are some of the community resources that you collaborate with? For example, are there certain churches or charitable organizations you work with?
Absolutely. So we talk about assets that the community has, and many times we talk about the deficiencies or needs, But I think our program focuses a lot on the assets. And one of those assets is the fact that we have a very robust Latino media, Spanish-speaking media. And we collaborate with them most of the time. Our county actually has radio shows and TV shows where we're able to inform people in the Spanish language about our resources and opportunities that we have here in the county. So that we need to take advantage of those. The other thing is we have a large segment of nonprofit organizations, community-based organizations that provide all kinds of services for employment, social services, healthcare, that we can partner with. And these are organizations that are focusing on serving Latinos and other immigrant communities. So that's a tremendous asset that we have. Another major asset, and you probably have seen this in your practice, is that we have a large number of very educated, well-educated Latino professionals,
Yes.
health professionals, who were formed in Latin America, who have come to this country, and they have not yet integrated into the healthcare system because of barriers with licensure and other pieces. But yet they're a great asset for us to be able to work with them, and they volunteer for many of our programs to help reach the community. So churches are there too. You know, many Latinos are people of faith, and they attend churches, and so we try to collaborate with the churches to be able to reach the community. So I think we have a very strong network of agencies, and through the Latino Health Initiative, we have built many partnerships. Every single program that we do in partnership with others, including our hospitals and other programs in the Department of Health and Human Services as well.
We have 1 minute before our break. I know that, as you mentioned earlier, challenges for the community include language as well as advocacy. So tell our viewers briefly, what is MC311?
MC311 is a line that it's manned by the county. It's a line where anybody here in Montgomery County can call and find out about any type of county service. It could be health, social services, police, garbage, any type of service that you need that it's related to the county government. You can call 311 from a line, and they will connect you to the adequate program. I called them the other day because I had a tree that needed to be planted in my house, and I didn't know when they were coming. So any type of service that relates to Montgomery County government, people can call 311, and they have the service in different languages, including Spanish as well.
Right. We're going to pause briefly for a public service announcement. When we return, more with Sonia Mora and discussing the Latino Health Initiative. We'll be right back.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning. Why?
Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
We're back. My guest this evening is Sonia Mora, Executive Director of the Montgomery County Latino Health Initiative. Ms. Mora, when we paused for the break, we were discussing the background of and challenges of providing health care for the Latin community here in Montgomery County. Let's now go on to discuss some of the specific programs that the Health Initiative offers.
Sure. So I'm going to go over some of the main roles that we play as a Latino Health Initiative. The first thing that we do is we serve as a coordinating entity. What that means is that we work with other programs and services within the department and outside the Department of Health and Human Services to actually avoid the duplication of services, do better coordination, and maximize resources. So we are all sort of on the same wavelength in terms of how to address Latino needs. The other thing that we do is we develop models of programs and services specifically tailored to Latinos. There is not much in the literature, even around the country, that for programs that tailor the Central American community, and so we have developed some models of programs. The other thing that we do is that we help agencies that are interested in serving Latinos provide some capacity building and technical assistance for them so that they can better serve that community. And the other role that we have is an advocacy role, is ensuring that services and programs actually reflect the needs or tailor the needs that the community has. So in terms of direct service, what do we have? Basically, we focus a lot of our efforts on health promotion, wellness, and access to care services. Those are the areas that we're mostly focused on. So on the wellness side, what we have done is we do a lot of outreach events to educate the community about how to take care of their health. In particular, we focus tremendously on the whole issue of prevention of chronic diseases, but not from a medical aspect, but more in terms of wellness. What do people need to do in order to stay healthy? What kinds of foods do they need to eat? What foods to avoid? The importance of doing physical activity. So throughout different programs that we have, including a health promoter program, what our health promoters do is they go to different neighborhoods throughout the county and different agencies or rec centers or different venues to talk to the community, do education, what we call charlas or just small talks, but we also have walks around the county. So we bring in the community to go out in their neighborhoods and walk and bring their children, and while they're doing the walks, they can be talking about the importance of healthy eating and drinking water and things of that nature. We have a very large festival that we have been doing for several years called Ama Tu Vida, Love Your Life.
Yes.
And Ama Tu Vida brings in, on the good years, when we had more resources, about 4,000 people.
Really?
We bring in over 50 agencies and 400 volunteers that come for a day to help us do health education, but also we do screening services for the community, blood pressures, oral screenings, blood sugar, all kinds of screenings, examination of the eyes. And the whole intent for us is to raise awareness about the importance of getting medical screening early. But the important thing is for those individuals who have abnormal results, before they leave the health fair, they have an appointment with a community clinic, a safety net clinic.
Excellent.
In our area. Because the main goal is not for them to be worrying about having a high blood pressure but not knowing where to go. The main goal for this is actually connect them to services in the county. So that's one of the pieces that we do. We also do some management of diseases, and we have particularly a childhood asthma management program. We do it through Montgomery County Public Schools and elementary schools, and we bring in the parents of children who have asthma through a series of about 6 sessions, and we talk to the parents about what asthma is, what are the symptoms, how to avoid the triggers, how to learn to manage asthma in their children. So that is a really successful program, and what we're trying to do with that program is to prevent children from ending up in the emergency room. Sure. Or being hospitalized because of asthma. We have a Latino youth wellness program that aims to educate kids in middle schools about how to take care of their health, but even more importantly, it's about conflict resolution, how to stay in school, how to avoid violence, how to work with the parents. So we work very closely with the parents as well to teach them parenting skills and to empower them to be able to go to the schools and talk to the teachers and maintain their children in school. That's a really important program. We also sponsor a program where we have a bilingual information line that serves about 5,000 people in a year, where individuals can call, whether they speak English or Spanish, and I know the line right now is serving other languages like French as well. So people can call in and try to find out what services are available in Montgomery County. But beyond identifying services, the line will help them navigate the system and help them to maybe set up an appointment at a particular clinic or service. So what we're trying to do with that is ensure that people not just have the knowledge, but actually can get into the service that they're looking for. So that's an example of an access program. More recently, we have begun working with families of children who've been fleeing violence, what are called unaccompanied minors.
Yes.
And so these children are coming here into our county with a lot of trauma, a lot of problems, and some of them have not seen their parents in a very long time, 5,
Terrible.
6, 10 years or more. And so part of what we do is connect the children and the families to services, but we have began also providing family reunification sessions and interventions to ensure that these families are going to be healthy, that they're going to be able to flourish and stay together, and that the parents can actually support their children. So those are some of the examples of the programs that we're currently running. And like I said, they focus on health promotion, overall wellness, and access to care, access to healthcare services.
It must be very overwhelming for a child unaccompanied by their adults to try to assimilate in the United States with different culture, different language, and no parental supervision.
Super difficult, and these are children that are already traumatized.
Right.
For whatever situation they were living at home, and that could be a whole different program
Yes.
that we could talk about, but they are fleeing violence from their own countries, and then in their journey to come to the United States, many of them get abused.
Terrible.
Or they see horrible situations, and then they come here for a new country, a new system, and sometimes they're not very welcomed by other children.
Terrible.
So it's repeated trauma for many of them.
You mentioned something earlier that I found interesting, that you're developing programs for members of the community from, for example, Central America. That implies that there are different needs for the members of the Central American community than, for example, Mexico.
Mm-hmm.
Why the need for different programs?
Because the backgrounds are different for people, and although we share a common culture, the Latino, Hispanic culture, there are nuances. You know, I'm from South America, and when I started doing my health education many years ago, I had to learn more about the Salvadorian community,
Yes.
why they were here. Even some of the ways they might communicate may be a little bit different. Definitely when you're talking about nutrition and diet, food preferences are different. It happens even here in the United
Sure.
States, right, with different regions. So in Latin America, that's one of the pieces where people may have different diets. And so that's a part that where we have to take into consideration. If you compare, for example, Salvadorians with maybe Puerto Ricans, that's a very different population and
Sure.
different immigration status and different backgrounds. So you have to kind of tailor the programs to look at those cultural nuances.
Very interesting. We have 1 minute left. If our viewers have any questions or want further information, how can they reach you?
Sure, they can contact us through our regular line, and the number is 240-777-3221. They can visit our website, www.lhiinfo.org. They can contact me through those numbers in the website. There's a list of our programs. If people want to volunteer, we're always looking for individuals to help out. And we're so grateful that you had us here tonight.
My pleasure, and thank you for providing important public health information. Thank you for joining us on Housecall.
Thank you so much.
My thanks to Sonia Mora for being a terrific guest here this evening. My thanks to my team here at the studio. And most important, thanks to you for making Housecall the success it has become. We're now broadcast prime time, 5 times every week. As for future programming, we'd welcome hearing from you. You can reach me at my practice website, montgomerygastro.com. Our next show will be an interesting one. I will have a doctor who specializes in a new specialty, surgical oncology, surgery specifically focused on cancer. It's going to be a fascinating show. See you then next time for another edition of Housecall. Good evening.